The inside of it is.
Okay.
It's a thinking game. I do that all the time. Okay, so what else?
Now
So
you,
what else?
now you dip the tip in your
Dip the tip,
cylinder.
but make sure you hold on to this, okay? Make sure you hold on to this, because it can be what? It can be flat. So you dip your tip, and it's not on, okay? You dip your tip and you test your suction, okay? At that point, I want to tell my patient, I'm getting ready to suction you down your trach, okay? It's going to be a little bit uncomfortable. What am I going to do now?
Insert it.
Insert it. Am I going to be on a suction off?
Yeah.
Off. I can't go in suction. I have to be off the suction. So now I got to go down. I cannot touch this. I can't. And hopefully he'll feed. Okay, at this point he's going to do what?
Cough.
Cough. When he coughs, I need to come out. Okay? Just like that. What else do I do now?
Dip it.
Dip it. What else can I do now?
Go back in.
Go back in. Am I on or off?
Off.
What's my motion for coming out?
Circular, twisted.
He's in, he's coughing.
Twisted.
Intermittent, coming out. It's done. Okay? Questions? What else am I looking for now? I'm looking to see how he tolerated that. I'm looking to see what color it was. I'm looking to see, do I need to hyperoxygenate him again? Okay? Most times when you suction them, they got to catch their breath. Okay? To get rid of the suction catheter, I just fold it in my glove, and I can get rid of all this. Okay? You're going to have to figure out what's sterile, what works for you, what's your dominant hand, what's your non-dominant hand. I don't even know. Anybody got it?
Sink and trash can over there.
Okay, so now he's suction. What do I want to do after this? Give him a chance to catch his breath, right? Okay, what else can I do after this? Listen to his lungs. Okay, I can listen to his lungs again. See if what I heard, and most time what you hear is upper airway bronchi. Make sure that's cleared up, okay? After you suction your patient, you're going to have to give them a little bit to catch their breath, okay? Then you can set up for your trach care. I need a kit. I guess that'd be good if I had a kit. So here, your saline is gonna, you're gonna need to use your saline again. Okay, so we're on the vacuum. So I'm gonna perform hand hygiene. Oh, this kit is probably too good. This the good kit. They don't have nothing. Okay, depending on what your kit has, this has everything in it. Okay, this has everything in it. So if I have everything in my kit, I'll give this back. If I have everything into my, huh? You're gonna give me the one that don't have nothing in it.
Yeah, that's the one
That's
that
That's the one they got.
That's the only one we have.
I have an extra one. I have an extra one.
Okay, that's all right. That's fine. She said she have an extra one. That's
Here's
why.
one over here.
That's why y'all got a lot of it.
I don't know how that one is set up. Is this the one you want?
Yeah, that's kind of.
This one realistic.
Yeah, that's kind of a joke. Show you how to get around it. Okay. So here it is. Yeah, this is pocket nurse. So I'm gonna open this up. Once again, I'm always assessing my patient. I don't need the suction anymore. I can turn that off. Okay. So I'm gonna open this up. Okay. Depending on what's what. This one doesn't have the saline in it. Okay. You have two things in here. You have your gloves, right? So you can put your gloves on first, okay? Because they're on top, right? But when you put them on, you have to do what? You have to do what?
I would pour the saline.
There you go. Open your saline up. If it's there, open your saline up. You have to realize, get ready to work with this. Because once I lose my hand, I can't do anything, right? So make sure you open that saline up if you can.
I would pour it before I do that.
She
can use one hand. She can put.
Why can't you pour it first?
Where are you gonna pour it? Put it on top of your gloves?
Well, the gloves are in the.
The gloves are on the other side.
You need a pour.
I would pour it before.
What? That's what I'm saying. Figure out what you want to do. This one even had a catheter kit in it. I don't need it. I don't need it. Here's a drape for you, right? What would you do with this drape?
Put it on top.
Why would you put two on here?
Put it down on the table.
Put it down.
Throw it away.
That make me a stir feel. I would throw that on. Why? Because I can throw all this over there, right?
Right.
Usually students have a hard time working in here. I'm just saying. The lady was good, but she been doing this for how many years? So if you take everything out, you got working room. Am I right?
Mm-hmm.
So I have to figure out who's dirty, who's clean. So then I can pour my saline in 3 compartments, right? 1, 2, 3. Okay, I got the saline in there. What else do I need to do now? I can take this, like she says, and moisten some, because all this is sterile. Am I right?
But you're using the bottle.
What?
Not your hand, your hand.
Oh, I touched the bottle. Okay, shit. So we're gonna go back. We're gonna go back. Act like I didn't touch the bottle. I touched the bottle. So I got to do this. I'm sorry, y'all. I touched the bottle. Boy, I tell you, you're like, oh, she touched the bottle. Oh. So I broke sterility. No problem.
Questions.
What else can you do? Just work with one hand, right? That's all you gotta do is work with one hand. That's all I'm doing. Like I sure did touch the bottom. Good for you all. Okay, what else I need to do now?
Professor Bryant.
Hey, I don't do it like this. What else do I need to do?
I go in and clean that little thing on the outside.
Huh?
You gotta take out his inner
You gotta
cannula.
take out his inner cannula with what? The dirty hand.
Stir hand. Oh, the dirty
The
hand.
dirty hand. Okay, and then I gotta soak it, right?
Because once you touch it, it's not sterile.
Okay, here's the deal. Is it really gonna fit in here?
No.
That's why you have the bigger compartment.
That's why you have what?
The bigger compartment.
You have the bigger part, but is it gonna fit in here to rinse it out either? No. So the compartments are kind of like, you can throw it in the larger thing to rinse it, but I'll do it like this, whatever. Not that serious. Then I gotta do what with this, guys?
The scrub, but not that one. The metal one.
The pipe cleaner. See, I'm paying attention.
So now we know what.
This is,
Don't put your cotton swabs on top of your pipe cleaner, because
Yeah.
it's gonna stick to it.
Stuck to it.
here it is. You gotta clean it, right? So what is this now? Dirty. What else I gotta do with it?
Now you gotta dry it.
Rinse it first and then
They
dry
got the
it.
pipe cleaners, right? What are you supposed to do with the pipe cleaners?
Dry it.
Clean the pipes.
They use it sometimes to dry it. Okay? What else you all wanna do with this?
Put it back in.
I'm gonna put it back in. Do you wanna dry it off a little bit?
Yeah, you can place it back on.
Okay, how can I do that? Right? Put it back in there. Make sure you put it back in there up the right way. It goes like the curvature, like this is not gonna work. Okay. It should not be this hard. It is what it is, though. Okay. Now you're done.
You're freaking us out.
He doesn't have a dressing, but at this point you do what?
Remove the old color.
Change your dressing.
No, you keep it on, but you add
Take your
another
gloves
one.
and then start cleaning out the.
The stomach.
Yeah, take your hose.
This hand is still sterile, so I can reach and get a dressing that should have been there, but it's not there, okay? And then I can get rid of this, right? What else I gotta do now? Hand hygiene, put some more
The
gloves
gloves
on.
on.
Okay, make sure you put on 90,000 pairs of gloves. Okay, what else I need to do now? I don't have to be sterile anymore. I can do anything I want to.
You clean underneath the collar.
You clean underneath the collar, that's what this is for, okay? You clean underneath the collar. And you can use your pipe cleaner, and that's the best way to do. What are you doing also? Making sure you're holding on to this, okay? Because this is when he's really gonna, so you go out here, and you're looking what? What else are you looking for?
Assessing.
You're assessing the skin. Trust me, the skin is always broke down here, okay?
I could have sworn they looked dirty for a second. I was like, ew, what the heck is going
So
on?
if this face plate is dirty, what are you gonna do with that? Clean it, and sometimes you need to get your other and clean it. And this can be very gunky or whatever, so clean that as well. Make sure you hold on to this, because this is where the patient starts coughing. I'm telling you, this is where you're gonna run into the patient with him coughing, okay? What else do I need to do now?
Now you're gonna change the
Ties. Okay, so hand me the ties. We have different types of ties for you all. Here's your ties. You can put the dressing on. It depends on how you, it doesn't make a difference. You can put the dressing on, give me the drain stuff. You can put the dressing on them.
There's one right here.
It's here.
Oh. You can put the dressing on them. If you want to put the dressing on after you put your trach ties, that's fine. Make sure you're holding on to this. You might have to loosen this to try to get to him, okay? Make sure you stay far enough back, just in case he coughs in your face. Okay, does that make sense?
Because it will happen.
Huh?
It
will
will
happen.
happen.
They cough all the time. This is their airway. Okay, there you go. Okay, there you go. So now that's done, and then now you can begin to do what? The ties.
Change the
What
ties.
about your ties?
Leave the old one on
Absolutely. Why?
because it can come out.
Because it can come out, absolutely. It's the only reason it makes good sense to leave it on. Even though you'll fight to get it through. And you'll
Like
see
putting-
people take this off, but I would tell you to leave it on. It's the safe way, because if you lose somebody's airway, trust me, it's gonna go all across the hospital. The nurse took it off. You adjust it. Bring it around. Trust me, you will fight to get these in here, but they'll go. If your patient is coughing, make sure you wear a mask. Okay?
With a shield.
With
Or
a shield,
goggles.
because they don't have, they have no control. I can't even get this in. Jeez.
Let's go to the gloves.
No, move to the other side. Let me just move to the other side, 'cause I can't get it open. Excuse me. It's okay to use both sides of your bed. Put your side rail up, though. Oh, thank you. Put your side rail up, okay, before you leave your patient. Don't do it like Professor Bryant. Okay. So now they both are in place, right? And now you're gonna do what?
Test it.
Take the old one off. What are you doing also at this time?
Making sure it's not too tight.
Making sure it's not too tight. What else are you doing? Looking at the skin behind it. You might have to, once you start removing this one here, you can see where you need to clean it. If you need to clean around the skin, go ahead and get some more saline. Go ahead and clean behind that. Make sure you dry. Do me a favor. When you're doing this, make sure you take time to actually lift your patient up and look behind. Because where's the skin breakdown going to be?
Back of the neck.
Back behind. That's where his secretions are going to land. Okay? You'll be surprised what you'll find behind people. Always turn your patients. They got all types of good stuff for you. Then you can be the smart one. I found it. Okay. So make sure it's tight enough so he doesn't cough it out. What else you all want to do now?
You're gonna check it with your 2 fingers.
You'll check it with your 2 fingers, absolutely. This is too tight, isn't it? You don't know it until you really put your 2 fingers behind it. So go ahead and loosen it a little bit. It looks good, but you'll find out it is too tight when you put your 2 fingers. Okay, everybody wants to make everything real tight in nursing, okay? But make sure that it's not too tight. What else do you want to do at this point? You want to go ahead and assess him again. Get ready to see if there's anything else you need. If you need to give him some more oxygen, give him some more oxygen. You want to take this away.
The collar doesn't need to be centered in the back or anything.
It can, but it just depends. You know, like I said, it does. It can, but it's a mannequin, so he's going to be too big anyway. Yeah, but usually but it is centered across the back. It's not as centered as
Oh, I
it should
see.
be.
Okay.
Yeah, because it's too big for his neck, if that makes sense. But see, it starts here and it goes there. So, questions. What else would you do before you left your patient?
Make sure the oxygen's back on.
Put his oxygen source back on.
Make sure the
normal
balloons
prescribed
are
rate.
Okay, the prescribed way. Check his vital signs to make sure he's not in any type of distress. Okay, leave him sitting up for a little bit. Do not lower his head. Okay, people with trachs, they should not be laying flat. I think that's my pet peeve. Okay? So leave him sitting up for a little while, and then let the patient know you're leaving him sitting up, okay? Why? It's better for gas exchange, okay? Turn this off. What else you want to do? Discard this. How would you document?
Hand hygiene.
Hand hygiene. Okay.
Vital signs, how
His
the
vital
patient
signs,
tolerated
how he
it,
tolerated. What else?
sputum color and consistency.
Sputum color, consistency, absolutely.
The size of the trach, the catheter you use to suction,
The amount of that you could suction.
the amount of air.
How he tolerated it. Okay. Questions? Okay.